Round two. Oh, sorry. Okay. Okay, good afternoon, everyone. I'm Mayor Paulette Guajardo, and today we're here to provide a COVID-19 update to the community. We just had a joint news conference with Driscoll Children's Hospital where they announced that they would be conducting a vaccination clinic. This clinic will be held at the American Bank Center, located at 1901 North Shoreline Boulevard. The City of Corpus Christi is providing city infrastructure with Driscoll Children's Hospital's expertise for the delivery of the vaccine. And this is very important. It's a very important public health effort and a milestone accomplishment in our community partnership. This morning, the City County Health District launched the first inside Corpus Christi vaccination drive at American Bank Center as well. And I am very pleased to report that 500 vaccinations were administered in 1.5 hours. And on behalf of your City Council, we are very grateful to our Health Department, our county partnership, Corpus Christi Police Department, Corpus Christi Fire Department, and Matt Blasey and his team at the American Bank Center for their part in today's drive. I wanted to let you know, too, that on average, this morning's clinic was able to administer about 150 vaccinations per 30 minutes. And so the clinic today opened at roughly 8 a.m., and we completed approximately at 9:45. And this is very important because, as was mentioned in the previous conference, we constantly strive to improve our drives and to do better the next time. And so this is one of the things, being that this was the first time that the city is utilizing American Bank Center, that we were able to find the structure that we used, and the plan was very, very on track with what we were hoping for. That said, we're also in hopes of expanding the American Bank Center drive to include larger numbers of doses in the future. And this, of course, is always based on that supply that we receive. In the weeks and the months ahead, we anticipate receiving more of those vaccines, even though it's unsure. I continue to repeat this because we continue to hear it from a federal level that eventually, nationwide, we will increase the doses that trickle down to us or across the nation by 15%. And sometimes I hesitate to say that. But then I say, no, I have to say that because it's what we know, and you need to know what we know. And so we do have confidence that that should happen hopefully in the next few weeks. And we want to continue to give you hope that we are going to work and provide a plan for when that happens. As an informational part or point, I wanted to also update everyone on our COVID-19 dashboard that's located on our website at cctexas.com/coronavirus. It is going to include the number of vaccines administered by the health district to date. So today, at this moment, you are able to see that number of how many vaccinations we have administered through the health district to date. The number will be updated weekly on Mondays, and we are working to also include a county-wide vaccination number that includes all providers. As the city manager mentioned yesterday, the health district has held 8 vaccine drives in 30 days and has successfully administered over 19,000 vaccines. In total, at least 42,000 vaccines have been distributed between all providers countywide. And this is very important because it shows the strength of the partnerships that are at hand now serving you. And as was mentioned earlier, this cannot happen, these numbers cannot be and won't be without the strong partnerships between the county, the city, and then so many other partnerships that make these drives happen. So I wanted everyone to make sure they knew that this isn't easy, it isn't something that's easily planned. It's something that takes a lot of work between a lot of team members, and that's exactly what we are here for you and to serve you. So now we'll have a brief Spanish translation, and then we'll hear from City Manager Peter Zanoni.
Acabamos de tener una conferencia con el Sistema de Salud Infantil Driscoll que llevará a cabo una clínica de vacunación en el American Band Center, ubicado en el 1901 de la calle Shoreline. Esta mañana se llevó a cabo una clínica ahí mismo en el American Bank Center por parte del condado y de la ciudad, en donde se administraron 500 vacunas en 1 hora y media. Este programa piloto nos ayuda mucho para tener un sitio para ofrecer más vacunas para más personas en el futuro, pero todo depende de cuántas vacunas recibimos. Continuamos recibiendo información del gobierno federal de que vamos a recibir más vacunas, esperamos en las próximas semanas. Le quiero recordar que contamos con el portal de internet con información del coronavirus, en donde también habrá información de cuántas vacunas se han administrado. Esa información se va a actualizar semanalmente. La dirección es www.cctexas.com/coronavirus. Estas clínicas no serían posibles sin la ayuda de tanta gente que ha trabajado para que estas clínicas se lleven a cabo entre el condado y la ciudad de Corpus Christi.
Good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager. And what I'm going to address is the issue that we had yesterday, which was that over-registration issue that we dealt with in terms of registering persons for the vaccine drive today. And so we know that yesterday our software had a technical glitch, and several persons were registered that could not be vaccinated today. Yesterday evening, we notified them with a reverse alert from our health district that they were not eligible for the vaccine today. The city has apologized on several occasions, and we continue to do so. We know that put a lot of people at a hardship in terms of hoping they'd get the vaccine, and then they didn't. But we do have a complete fix for those persons, and I want to talk to you about that today. And so we told the individuals last night and yesterday with our reverse alert that the next vaccine drive, they would receive preference to be served first at the drives, at the vaccine drives. What we're going to be telling them right now, and then later on after this media event, we'll be telling 925 of them through a reverse alert that they will be eligible to get a vaccine Thursday at the Borchard Fairgrounds. We have 925 vaccines that are available to us through one of our partner agencies. And we're going to allow the first 925 that's on that oversubscribed list to come up to the fairgrounds Thursday, beginning at 10 o'clock, and receive a vaccination. Okay, so this is new news. I'm breaking it here. And it's part of our commitment to the community. We know that software glitch didn't do anybody any favors yesterday, but we're trying to make it right by this action. So Thursday at 10 o'clock at the Borchard Fairground, at that drive-through, 925 of the oversubscribed will have the opportunity to get vaccinated. Then the next vaccine drive that we have next week, which will probably be early in the week. We'll find out later this week how many additional vaccines we'll get for next week. The remaining persons, which is about 1,000 people, will be notified that they'll be receiving preferential, or they'll be first to be served at that vaccine drive next week. So that'll take care of the oversubscribed group that happened yesterday from a software issue. So one other thing to point out is that all the vaccines that will be provided on Thursday are Pfizer. Next week's probably will be Moderna, but we'll confirm that later this week and let the public know. So the 925 people that'll get notice today for their vaccination this Thursday, those vaccines will be Pfizer. The reverse alert message that will go out will include the date this Thursday, the time, and the location for the persons getting that vaccine. We want to remind people, and it will be done by the health district as well, to bring the QR code that those persons got. While they were oversubscribed, they still did get a QR code. So we want them to bring the QR code with them if they can. It can be on their phone, or they could have a printout. And if they can't find it, or if they have lost it, we can still pull up their name from the registry, but the QR code helps the process go faster. So if you have that QR code, bring it either in print format or bring it on your phone in a picture format. And then if you have any questions, we've been telling those persons too that have gone through this software issue that call our health district, our same coronavirus hotline that we've been using for 12 months, and that number is 361-826-7200. So 361-826-7200, and we can take care of any questions that you have there. So just a reminder, this has been, the pandemic's a fast-moving and unprecedented circumstance for the whole world, and as well for us here. And so we do apologize for things that happen when they don't happen in our favor or the community's favor. And that software issue is one of those things. We are improving processes, and we'll continue to do so as we continue to save lives and keep people safe. With that, we're going to do a Spanish translation, and then Nueces County Judge Barbara Canales will come up next.
Quiero hablar sobre un problema que tuvimos ayer con el sistema de cómputo, en donde estuvimos registrando pacientes. Algunos residentes no recibieron la confirmación de su registro, pero ya se trabajó en ese programa para remediar la situación. Las personas afectadas podrán ser vacunadas en el Centro de Exposiciones Richard Borchardt este jueves. Van a ser 925 personas las que van a calificar y lo podrán hacer desde su automóvil. Esta semana tendremos información de la llegada de más vacunas y las ofreceremos al resto de las personas afectadas que no lograron ser vacunados el día de hoy. Las personas que califican para las vacunas van a recibir un mensaje mediante el sistema Reverse Alert. Recuerde llevar su código de respuesta rápida o QR Code en su teléfono o impreso. Si tiene dudas o preguntas, se le pide llamar al Distrito de Salud al 826-7200.
Okay, so as we do back-to-back press briefings, I get to start this one off with a smile and say bravo to American Bank Center, to Health Department, City County Health Department, to the City of Corpus Christi, and to all the people that make all of these events possible. It's bravo because we tested a new site today. This is absolutely critical in our mission to expand our availability of the vaccine. Not only did we test a site, we tested a new method. How does it work when we pre-register and when we use a call center? And it can work very effectively. Now, you just heard that, we're going to have to make some amends, so to speak, for those that were registered that were not able to attend. What we want to emphasize, and this is exactly what City Manager just said, but just to be absolutely clear, on Thursday, we're going to do 925 people who are already registered. This is not an open call. This is a very select group that that we did not finish today, right? Because we did not have sufficient vaccine that we're going to get on Thursday. So I think that, as always, Murphy's Law is in action. That's really what we've learned through this pandemic. And we just keep adapting. Remember, when Darwin talked about survival of the fittest, he talked about the species that could learn to adapt the best. And I'd like to think that we're one of those groups here in Nueces County. We learn how to adapt, and that's what makes us the strongest. And so I ask you again for your patience, for the imperfections. But it is a very good sign today that we have a new venue that can have it can truly become a mega site. It might have been a mini clinic today, but tomorrow it becomes a mega site. And that means that we'll be able to vaccinate over 1,000 a day easily in that venue. And guess what? As we do those particular sites there at American Bank, we're going to get better and better at it. That's what's happened to us at the fairgrounds, and I think that that's exactly what's going to happen here. So all that we did today was to prepare our community for the future, for receiving more vaccines, and to create more mega sites. And for that, I salute all that were involved. And again, we stand ready to answer any questions you might have after this press conference. But from the county's position, once again, I looked and really marveled at all that we've been able to accomplish. We make these decisions to open these sites in less than 7 days. We're just a highly functioning machine here. And I want to, again, reiterate how proud I am to be able to be a part of this unprecedented effort to care for our community. Thank you.
Primero quiero decirle bravo a todas las personas que trabajaron para llevar a cabo la clínica móvil en el American Bank Center el día de hoy. El día de hoy también se va a evaluar el centro, el sitio, las llamadas y el programa piloto. Ya escuchó usted que el jueves se van a vacunar a 925 personas que no lograron ser vacunadas el día de hoy. Esto es solo para quienes van a recibir la notificación, no es una invitación para el público en general. Me da gusto poder contar con el American Bank Center como otro sitio alterno de vacunación. Lo que hicimos hoy es la preparación para clínicas a futuro. Estoy maravillada de todo lo que hemos logrado en tan solo unos días y quiero agradecerle a todas las personas que hicieron este esfuerzo posible.
Good afternoon, Annette Rodriguez, Public Health Director. I'm going to start with the Nueces County COVID-19 statistics. First slide, please. And this is basically showing the daily COVID-19 cases for the last 2 weeks in Nueces County. If you look where it starts at 210, if you go all the way to January 26th, that first week there, that's makes up 1,097 cases for last week. If you start on January the 27th to today, that makes up 1,254 cases this past week. Next slide, please. This donut diagram basically shows the total number of cases in Nueces County, which is 32,148 people that have recovered from COVID-19 in Nueces, but also the active cases, 2,804, and that's the really concerning number to us because these people have active COVID-19 and can actually still spread that in the community if they're not isolating like they should be. 658 deaths that I'll talk more about, for a total of 35,610 cases of COVID-19 since March of 2020. Next slide, please. The hospitalizations are interesting because if you see on the right far side 174 cases, they kind of bump up to 178, and now you see this decline. But this decline doesn't necessarily mean that things are good. And the reason is that people will die, people will be transferred to the intensive care unit. So we're at 156 COVID-19 hospitalizations in Nueces County currently. Next slide, please. Here are the ICU patients. So if you look at the far right side, you see 49 in the ICU with COVID-19. And then you see, as of today, 56 cases in the ICU. So an upward trend in the ICU, and we've all heard about the lag from the time that you actually get COVID-19 to the time that you become hospitalized to the time that you go to the ICU, and some to the time that they will pass away. Next slide, please. So the total COVID-19 deaths is 658 total cumulative deaths in Nueces County. Today we had 2 deaths. My condolences to their families, 1 male, 1 female, 1 in their 50s, 1 in their 80s. The comorbidities included diabetes, obesity, and high blood pressure. And the last slide, please. These are the deaths for the last 2 weeks. If you look at for the first week up to January 26th, you'll see 23 deaths last week, and this week 24 deaths due or related to COVID-19. So as of today, the Health District has successfully conducted 8 COVID-19 mega vaccine drive-thrus, as you heard earlier. Our latest drive-thru was this morning at the American Bank Center. This drive-thru was a pilot so that we could see if this would be a possible established location. The clinic was very successful. We vaccinated over 500 people through the American Bank Center within just about an hour and a half, to be honest with you. Although successful, there's always room to improve, and lessons learned today will be addressed to enhance and refine future drive-thrus. One question that many people are having is, what is a vaccination hub anyway? And so I'm going to answer that. Beginning in January of 2021, Texas established large vaccination sites, or what is referred to as a hub site, around the state. Due to our tremendous vaccine efforts, our city-county health district was approved by the state of Texas as a designated hub. The goal of these hubs is to provide large groups of people with vaccines within a few days of receiving the vaccine. Currently, Phase 1A and 1B eligible individuals may receive a vaccine at these hubs regardless of where they reside. Just recently, you heard Driscoll Children's Hospital also became an approved vaccine distribution hub. 2 hubs in this area will tremendously increase our vaccination rate. However, despite being assigned as a vaccination hub, the vaccine supply is still very limited. Therefore, please be patient and keep checking our social media as well as our website and Driscoll's website so that you know when we each receive vaccine. If you are able to come to one of our mega hub drive-thrus, please do so. Remember, mass vaccination drive-thrus are not for everyone, but they are one way of getting large groups of people vaccinated more quickly. Other vaccine providers in our community also receive vaccine, and they may have systems that work better for your needs. Our website, www.cctexas.com/coronavirus, has an interactive map that shows providers in our community as well as vaccine availability. Please check with the provider before you show up, as they may have different methods for their vaccine distribution system. We've also been tracking another vaccine manufacturer who's getting ready to submit the FDA emergency use authorization, Johnson & Johnson. Johnson & Johnson has also shown a greater than 66% efficacy in their trials, which qualifies them to review under an emergency use authorization. Once the FDA panel has reviewed, and if approved, then we would have 3 vaccine manufacturers. Having more manufacturers will increase our vaccine stock and therefore allow us to have more vaccination mega drive-thrus. Altogether, our mega drive-thrus have distributed more than, as the mayor said, 19,600 vaccines. This feat would not be possible with all of our partners and volunteers who have helped to make this a success. We thank you for your help, and we hope that we can continue to count on your support for many more mega drive-thrus to come. No one is safe from this virus until all of us are safe from this virus. Stay well, stay protected, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 211 casos confirmados por el coronavirus. 32.148 pacientes se han recuperado por completo, 156 continúan en el hospital, 56 están en la unidad de cuidados intensivos, 2.804 son casos aún activos. El día de hoy se reportan 2 fallecimientos a la fecha. Los fallecimientos totalizan 658 personas. El Distrito de Salud ha llevado a cabo a la fecha 8 megaclínicas móviles, el día de hoy la más reciente, la cual fue piloto para poder evaluar el sitio del American Bank Center como arena para más clínicas a futuro. Hoy se distribuyeron más de 500 vacunas en hora y media. Desde enero, el estado de Texas estableció varios megacentros de vacunación. Nuestro Distrito de Salud fue designado como uno de estos para poder así vacunar a personas que pertenecen a las fases 1A y 1B. El Hospital Infantil Driscoll recientemente fue asignado como centro de vacunación, pero todo depende del suministro que se tenga de vacunas para así seguir ofreciéndolas al público en general. Le queremos recordar que existen varios sitios de vacunación y las megaclínicas desafortunadamente no son para todas las personas. Más información sobre nuestras clínicas la pueden encontrar en nuestro portal de internet a la dirección www.cctexas.com/coronavirus. Ahí encontrará un mapa interactivo que muestra a proveedores registrados en nuestra comunidad, así como la disponibilidad de vacunas. Consulte con el proveedor antes de presentarse, ya que pueden tener un método diferente para la distribución de la vacuna. La farmacéutica Johnson & Johnson presentará su vacuna a la FDA para su autorización. Esa vacuna es de solo una dosis y ha presentado ser más del 66% eficaz. Si es aprobada, entonces se contará con 3 vacunas disponibles para la comunidad. Así podremos ofrecer un mayor número de vacunas a nuestra comunidad. A la fecha, no hemos recibido notificación de nuestra próxima asignación de vacunas. Una vez que la recibamos, se lo enviaremos para que los residentes puedan planificar visitar nuestro megacentro de distribución de vacunas. En total, se han distribuido más de 19,600 vacunas en nuestros megacentros de vacunación. Esto no hubiera sido posible sin el arduo trabajo de nuestros empleados y voluntarios y le queremos agradecer todos sus esfuerzos.
Thank you. And this concludes our briefing for the afternoon. We'll take questions now.
Hey there. So I'm looking at some of the comments people are talking about online right now, watching with us here. One person had a question about if you get your first vaccine in Robstown, can you get your second one at the American Bank Center? Can you talk about the two-dose process?
Sure, that's a great question. So if you received your first vaccine of Moderna at the Richard Borchard Fairgrounds, you can receive a second dose of Moderna almost anywhere, to be honest with you. So if there's places that have Moderna that have an open invite, you can go there when it's your time. Moderna is the first dose, and then 28 days later, up to 42 days later. So they've extended that time. But yes, you can go somewhere else, but we will also notify you, because what the state does is they send us doses and they allocate them as second dose allocation. So if we did 500, we get an allocation of 500 second doses. We know it's time to give those individuals their second doses. So we reverse alert them, we text them, we tell them, this is where we're gonna be with your doses. So come, we give them their password so they can get into the gate, and then we get them all vaccinated. Thank you.
Okay. Yeah. Thank you very much. And thank you guys for attending.